So let's go through some of the treatment options that you have when you're engaging in cancer rehab services. There's an arsenal of treatment approaches that are here to support you. So, flexibility, ease of motion. Maybe you're experiencing pain or tightness. A therapist is here to help relieve that discomfort and help you move through life a little bit easier. Super important to maintain your vitals, which means we're looking at your body's response to the treatment that you're currently having. What is your fatigue level? And is someone helping you to properly dose your activity? Your mobility. We're taking a look at how your balance is, and are you safe with movement? If you need an assistive device like a cane or a walker, we're there to help support you with these temporary or more permanent devices to support your balance and safety. Your therapeutic treatment may include things like taping. If we notice that some of your muscles are not firing or being used properly, we can help with this taping technique to improve how your muscles are engaging. If your muscles are firing too much and you're experiencing some tension or pain, sometimes these different techniques can help with preventing aggravation. And these are part of manual techniques. I always say that every patient who is experiencing discomfort should have the capability of receiving manual care. This manual care can include blood flow to the region, pain relief, flexibility, and movement. Do any of these treatments surprise you? Are you excited that this is part of your possible care? So we talked a little bit about keeping active. I think that's a common phrase used often within oncology. Make sure that while you're going through treatment, you keep active. But I often hear from patients, how much is too much and how much is too little? Well, a cancer rehabilitation specialist is there for you during this time. This is what we specialize in. We know that moderate aerobic activity and exercise, at least 150 to 300 minutes per week, can be really helpful in not only maintaining your function and reducing your fatigue, but it also can help with your reoccurrence of cancer itself. So we add resistive exercise to this formula, and this becomes your comprehensive education on how to move forward during your cancer treatment and beyond. I think a lot of patients really love the fact that we can arm and empower them, and giving them this information is power. Just like people say, knowledge is power. So here are some of the tips that we share with patients often. So just like I said, avoid inactivity, but we go the extra mile to add more to that sentence, right? We help you to understand what goals to set and how to set them, how to monitor your symptoms. We talked about vitals before, so how your body is reacting to movement and exercise, and really allow you to engage and understand the intensity of your workout. We help you establish a routine. Not everyone loves to exercise or has included exercise in their life. So it's super important that we teach you about activity as well. And establishing a regular routine can help keep you safe and help to manage side effects moving forward. We also teach about tracking your activity and how to progress that activity and make slow, gradual changes over time. These changes can help you sustain an active lifestyle. And as we talked about, it helps to empower you to manage your body during this time period and beyond. We also make sure that you understand about the buddy system. When you work or move with others, you're more likely to have fun and be creative in how you engage in life. And we're there for you for support. This gets to be your active lifeline for understanding what's right for you during your cancer treatment and beyond. So now that you may know someone or you yourself might be ready for cancer rehab services, how do you find someone in your region? So you can find a cancer rehab trained specialist in your region by looking at your cancer treatment center, your hospital, or a specialized therapist in your community. There are several resources that can help you find a cancer rehab trained specialist. The American Physical Therapy Association has a special page dedicated to cancer rehab specialists. The program Revital Cancer Rehab across the country has 26 plus markets that offer cancer rehab services within the community. There's also Pori and Lana, who also have websites, as well as a few others listed here. In summary, cancer rehabilitation is a specialized treatment and a partnership with you. We're here to help you address your pain before, during, and after cancer treatment, and we help to improve the tools that you have access to. We provide strategies for physical and activity and exercise, and we help you return to work and life. I hope that you learned something new with this information, and please reach out if you have questions and or concerns. Thank you for your time.